within this region, as a commissioning team, there's always been a really strong focus on involvement, on the culture of secure services, really focusing on recovery and moving people through those services as quickly as possible. The first thing is that talking about service user involvement in isolation is pointless. You know, we've always made the point of focusing on involvement in general, because I think the practical experience was that if you just try and involve service users without involving the staff who are directly involved in their care, you just create a split, you create a schism, and you create tension. So the big lesson that we learned was that, and we had a strategy around this, reaching joint solutions, was that the way to really change things in services and to get services working in the way that everybody thought they should work was to encourage collaborative framework where staff and service users worked together and developed a joint approach, a shared understanding of the way things ought to be done. I think that was probably the key lesson. It was also really important for those people that commissioners were hooked in to that and part and parcel of that process. So the fact that service users could see that people who commissioned services were interested in what they thought and what they had to say, and the staff who worked in services could see that commissioners were interested in what they thought and had to say, and would actually take away the products from that group and embed those into the national standard contracts, so that services were performance managed and measured, you know, how well they'd implemented things along that recovery and involvement agenda was fantastically empowering for people, I think. So that's why it's important for commissioning, and that was, you know, I guess that's been my experience of the last 6 or 7 years. I think it's important that there's sign up at all levels to it. It's particularly important that commissioners are not just seen to support the initiative, but they actively give up their time to go along to the meetings, to the groups, give up the time, show the commitment, walk the walk as opposed to talking the talk. I think that's very important. But it's also important that there's buy-in from the services that are participating in that. So, you know, whilst it's very important that the staff directly working with service users and the service users are jointly involved, it's also important that those organisations that those services sit in have senior buy-in. And I think if the commissioners don't buy into that, neither will the senior staff in the service of the organisation. So that involvement in the process from the commissioning side of things is absolutely key. And we know that from the feedback that we've had from service users, the fact that somebody who, you know, commissions 20 different services and manages a budget of over £100 million, the fact that he could be bothered every month to turn up and, you know, chew the fat with people in those services meant a huge amount.
So I first became involved really when I was in hospital myself, in Secure Hospital a few years ago. And at the time I didn't feel very involved in my care and treatment. There were lots of us who didn't really know what we had to do to move on through the Secure Hospital. We didn't know what we had to do to leave hospital and move back into the community. So gradually, as I became well enough, I got involved, for example, on the ward, in the community meetings. I was the ward representative, going to the Patients' Council. So that was something quite new when I was there a few years ago. So we were definitely trying to get people more involved in the running of the hospital and having a voice, having a say. And that's quite hard in Secure Hospital for people to do that if they don't feel very involved in their own care and treatment. And because a lot of people were saying those things, a group of us got together from around the country and really tried to do something about improving the recovery focus of secure care. So we wanted to be concentrating on the positive aspects of our lives and rebuilding our lives, having more meaning, and also having a sense of hopefulness. So we got together, had quite a few meetings about what can we do about this, and really it was the start of something to develop what became known as an initiative called My Shared Pathway. We wanted to look at what would help us move through our pathway in a more timely way, because some of us were spending an awful long time in services, and as I said, we didn't really know what we were trying to achieve. So we developed some materials. We started working in a much more goal-focused way, or an outcomes-focused way. So we developed, we looked at what areas of our lives were particularly important in our care and treatment, and we developed some outcome areas with some goals and some milestones to help people know what they were trying to achieve and how to measure what they were achieving. So we developed My Shared Pathway as a recovery-focused and outcomes-focused initiative, and we thought, how can we actually support people in units to actually work in that kind of way? So we encouraged services to develop recovery and outcomes groups in their own service, which would bring together crucially bring together service users and staff and managers of the service to actually talk about how can we provide the care and treatment that people need in that recovery focused, that very positive focused sort of way. We also thought at that time that it would be really useful for services to meet together, so rather than just working in that way individually, that we wanted to bring services together. So in each of 9 regions across the country, we developed some regional recovery and outcomes groups, where again we brought together representatives from each service in that region, both service user representatives and staff, and also crucially we brought the commissioners of those services, so the people who pay for us to be in hospital, we brought them or invited them to come along as well. And I have to say that when we brought people from different services together to discuss how things were going, the difficulties, the developments in their service, and to share best practice, something quite magical happens.
We believe that it's about people coming with their experience, and that everybody's an expert in their experience and has something to offer and something to bring and something to share.
We always say the process is more important than the outcomes, and I think all the groups that we hold, the regional groups in Yorkshire and Humber, they're quite informal. They're quite fun. You talked about fun, and that's really important. And it's a big step, I think, a lot of the time for a service user to come to one of those meetings. Don't really know what to expect, and there's often involvement from case managers and commissioners, and I think once someone comes once, they often come back for a long time until they get discharged from the service that they're in. So within services, there's going to be some sort of hierarchies around. The staff have the keys, the service users don't. So just in that, as much as anything else, there's that imbalance of power. But when coming to the regional meetings, that all seems to go. Everyone travels together in the same car. Nobody's got keys. And the meetings take place in a rugby club in Wakefield. And so there's no security issues at all. And suddenly everyone, that balance of power completely shifts. It goes away completely. And that's palpable. Everyone feels that actually we're just people around a table. And we're all working towards the same thing, and we all want to find solutions to that. People actually, they're really proud if they do something really well in the service that they're in, and they go to a meeting and realise that actually we're doing this in our service, but other services aren't doing it. But they want to contribute their ideas and the good practice that they've developed in their service to improve other services. And so that doesn't actually benefit them because they've already got that initiative or whatever it is. It's not selfish at all. It's not about what's going to benefit them. They want to be involved because they want to help improve things for other people so that other people can have the same benefits that they've had.
So our Views on News magazine was launched nearly a year ago now, and it's service users put articles in, and we edit, format it, and it goes off to get printing, recipes, health and well-being. Simon Sears, who's the head of services, we give him the question and he answers it. And jokes, reviews, and people go to the pictures, put articles in for the pictures. And Sarah takes it out and gets it all formatted up and edited.
I find that activities in hospital very positive. I find it gives you structure and routine, and it is very helpful for you getting involved in your treatment, because I think each patient as an individual needs to show the doctor what he's capable of, show the doctor his skills, show the doctor or the team that is working with him that they are capable and able to follow a routine. It's very important to make progress, I feel.
Services are starting to feel more valued for the work that they are putting in, that their opinions and their feedback is important, and that they do have an actual valid say in their care, something that will make a massive difference to them because they actually feel like they are making a difference for other people. Well, they're the masters of their own experience. They know exactly what they're going through in the hospital or the service that they're in at the time. I think that service user involvement provides that barrier, that breaks down that barrier to allow service users to say, this is my experience and this is exactly what I'm saying, and you need to listen to that. And I think that services are starting to listen to that now, which is really important.